Hi, I'm Professor Finlay McRae. I'm a Professor of Medicine in the University Department of Medicine and also Head of Colorectal Medicine and Genetics at the Royal Melbourne Hospital. Today we'd like to talk about bowel cancer, otherwise known as colorectal cancer. Cancer is a genetic perturbation of cells, in this case in the lining of the bowel, such that they collect the capacity to grow in an uncontrolled fashion, and they invade through the bowel wall. They then become malignant, and that's what we know as a bowel cancer. About 15,000 people develop bowel cancer in Australia each year. Around about 5,000 of them die. So the overall survival rate is around about 65%. Many of the cancers are preceded by a status of polyps. Removing the polyp cures the problem. However, if it's spread into the bowel wall or through the bowel wall or even more progressed distantly, then they are different stages, and the mortality or chance of surviving goes down the greater the spread through the bowel wall and remotely into organs such as the liver. We do like to be able to detect it at an early stage because the early stage offers the chance of cure. Bowel cancer presents with a number of symptoms. Patients come in with symptoms that are very common, such as a little bit of rectal bleeding. That's a primary symptom of bowel cancer. That's a worry. The older you are, the more likely it's going to be bowel cancer if you've got rectal bleeding. So anybody over 50, for example, definitely needs to be evaluated for bowel cancer if they've got any sort of rectal bleeding. Other things we think about are a change in bowel habit. If you had a change, you have an increased frequency, it changes in its form, or pain perhaps, particularly if it's associated with a change in bowel habit, abdominal pain. They're the main things. And then for more severe or more advanced cancers, you might be anemic, you might be losing weight, you might have lost appetite. They're usually symptoms that would be associated with more advanced disease. From the time a polyp develops, and that's the pre-malignant precursor, to an advanced cancer, that's probably 20 years. So the symptoms that we just mentioned are really only in the last 2 years of that time period. So there's up to sort of 15 years of preliminary development of the process that's going on before symptoms develop. And that time period, of course, is the opportunity for us to make a diagnosis with the best chance of cure. Because if you can make the diagnosis without any symptoms, you've got a very high chance that you've got either a polyp that's not malignant yet, or an early stage curable cancer. The National Bowel Cancer Screening Program offers a kit sent by the Federal Government's Department of Health to you if you're in the age group 50 to 74 every 2 years. This is the kit that arrives. And it's a kit that you could do at home. It's simple. This arrives in the mail. You open it up like that. What comes out of the kit is detailed instructions, and then there's a toilet liner, so you don't have to delve into the toilet. Your bowel action just sits on top of the liner, and then there are the sampling kits. You just open the kit, put the little pen-like device, which has got some corrugations on it, into the stool. It picks up very small quantities of stool. You don't have to do much, just dip it in and twist it like that, and then put it back in the container. You do 2 tests on separate stool samples, either on the same day or different days. It's a really simple thing to do at home. No stress, don't have to go to the doctor, don't have to go to the pathology service, all done yourself. If you've got a positive test and you're in that age group, then the chances that you've got a cancer are around about 4%. So 4 out of 100 people with a positive test will have a bowel cancer, and they won't know about it because they haven't got any symptoms at all. And the cancer, that 3 or 4%, they're almost all early. They're sort of stage 1, they're completely curable by either the colonoscopist when they get to have it, or by surgery if it's needed to go that far. Survival rates of 95% if you've got it picked up at that stage. Whereas if you wait till you've got symptoms, then you're down to a 60% survival rate.